One of the most common complaints that we find today in dentistry is what we call the dental emergency. And the most common dental emergency is a broken tooth. And we're seeing that particularly in the 40, 50, 60-year-olds, and that is a consequence of what we call the amalgam generation. What that means is, in previous years, the most common method of treating decay or a hole in the tooth was to put an amalgam filling, which is basically a mercury-based filling. Now, amalgam has been around for over 100 years. We know that it works, but like everything in life, it's not perfect. And the biggest problem with amalgam is that it depends on the tooth for support. However, through natural wear and tear, chewing your food, amalgam ultimately fails, because what happens is the tooth surrounding the amalgam filling develops little hairline cracks underneath. And then what happens is that part of the tooth breaks off. So what some dentists do is they give you a short-term solution by doing what I call patch dentistry. They just put a bigger filling. And then another part of the tooth may break off and put a bigger filling. And then ultimately what may land up is the tooth may completely crack and split in half. And therefore what that will ultimately end up happening is extraction. And often extraction, then we have to either go to dentures or to implants, etc. So, like everything in dentistry, prevention is better than cure. When I do a thorough examination, one of the things we do is we look for large fillings and we look for hairline cracks in teeth. And every tooth has a guideline, which is normally filled greater than 60% or more, is what we call overburdened, overweight in terms of, and it's fragile. And this doesn't happen with everybody, but in most people, it's just a matter of time before the tooth or the filling cracks. So we can overcome that, and that's by putting a crown on a tooth. Now, what a crown is basically simply, it's like a crash helmet. Putting a crash helmet over the tooth. So what that does is it protects the underlying tooth and stops the tooth from cracking, and therefore prevents long-term tooth loss. Also, if there are little crack lines in the tooth, what the crown does, it acts like a brace over the tooth. So it's like when you get a little crack in your windscreen, if you don't fix it, the crack gets deeper. So what the crown does, it hugs the tooth and stops the crack from going further down. That's why crowns are very, very important in terms of keeping your teeth and providing long-term protection.